Welcome to the Physician Associate Podcast.
Hello, and welcome to this episode of the Physician Associate Podcast. My name is James. Today, I'm joined by Nick Mattick, who is the Director of Physicians Associates Transforming Healthcare, or PATH. Welcome to the show, Nick.
Hi, good morning, James. How are you?
I'm very well, thank you. Thanks for joining us on the episode.
Looking forward to being here.
I wanted to get you on so that we could have a chat about what PATH is and what it's like running a business set up specifically for physician associates. Do you want to start by telling us a little bit about where you were and how you came across physician associates?
Yeah, of course. So I've been working in healthcare recruitment for about 18 years in various roles. So I've worked for recruitment agencies through to crossing over to working in general practice, working for GP companies. And my last employment, as it was, I was working for a company called Malling Healthcare, where I was the clinical recruitment manager. Malling Healthcare had about 60 GP practices, urgent care centres and out-of-hours services. And one of the biggest challenges is pretty much in any recruitment was trying to find clinical workers, the doctors, the nurses, and everything else. And we were part of scouring the country, trying to find GPs, scouring the world, trying to find GPs. And there was obviously a continuous frustration with that, trying to find people. And we found ourselves a lot of the time going to exhibitions and conferences, and we were busy trying to recruit GPs to come and work for us. At the same time, we were competing against the likes of, Australia, Canada. And it became relatively quickly apparent that it doesn't matter how widely you scour the world for more and more doctors and nurses, that everyone across the world is pretty much in the same boat. So we started looking at how we could look at alternatives to help support general practice, which is how we met with Jeannie Watkins. At the time, Jeannie was running a small recruitment company and was also involved in the FPA. We talked to Jeannie about the role of physician associates and how they could potentially impact. And at the time, that was back in 2013, 2014, very few PAs around anywhere. But we started talking to Jeannie about the concept of PAs, and we introduced a couple of them into some of our GP practices. And it worked extremely well. It just proved that we didn't have to keep fighting for the same doctors and nurses to backfill more and more vacancies. And actually, there may be different ways of looking at things. Our medical director, Dr. Tom Reichhelm at Malling Health, decided that we were going to support the role of PAs, and we sponsored a few PAs through their PA program with a view to hopefully they then coming to join us afterwards. That worked quite well, but unfortunately, the world of general practice wasn't really big on PAs, and it's taken an awful long time for that to change. And as we've moved forward, things changed with Malling Healthcare. We're all chatting afterwards one day, and the role of physician associates was still sitting there. So we spoke to Jeannie about how we could help maybe with Jeannie in taking things forward with physician associates. So at the time, Jeannie was still trying to practice as a clinician, and I think she was involved in FPA and she had a lot on her hands. So we decided to take her recruitment company and try and see if we could help take it in a slightly different direction, more around recruitment and development of the role of PAs. Not only just recruiting PAs, but also helping people to understand what a PA was, how they would fit into their workforce, how you could define and develop services around the role of physician associates to be able to take some of the pressure away from the doctors and nurses, to enable the doctors to really get on with what they're good at, and at the same time allowing physician associates to get on with what they're good at to the greater benefit of the patients. It was a slow, gentle development initially with the development of PATH, but as we've moved forward, hopefully we're still involved very much supporting the development of the role as well as just recruiting into those roles as well.
That's brilliant. Thanks, Nick. So what challenges were there 7 or 8 years ago when you were setting this idea into fruition?
I suppose the biggest challenge at the time was there really wasn't, and still is possibly, enough PAs to go around. As people started to see the concept of physician associates working, we could see everything that was going on and everything was moving in the direction, but there just wasn't enough PAs to go around. The first difficulty we had is where we're going to find PAs to be able to support the development of the role. And the second biggest challenge, I have to be honest, was that some areas of general practice really wasn't open to the idea. It was very much a case of, we're not sure what we do with these people. We're not sure how they fit in. Our patients won't like it. There was a little bit of negative press at the time going on around PAs. So there were a number of challenges to overcome. It was not only were there not enough of them to go around, there wasn't enough experienced people to go around, And equally, there was a little bit of negative press and a bit of pushback from healthcare professions. I think that's now very quickly changing. And certainly, I think people's attitudes are changing very quickly.
Certainly, the Advanced Roles Reimbursement Scheme into primary care has been a game changer, hasn't it, for uptake of physician associates into GP land?
Yes, ours has kind of exploded the role of PA into general practice, which is great. If I can be honest, there's still a little bit of me that still sort of feels that the RCGP could do a lot more to stand behind the role of PAs. If you look at the Royal College of Psychiatrists and the Royal College of Emergency Medicine and some of the other Royal Colleges, they really are embracing the role of PAs and standing behind them and in supporting them.
So some physician associates who are listening to this podcast will be familiar with PATH and maybe we have even worked with you in the past, but there may be some student PAs or some PAs that are newer to the game in other parts of the country who might not have heard of what PATH do and what you can offer. So how do you describe what PATH does?
We very much support the role of physician associates across the board. Hopefully, some of your student listeners may have come across us. We do presentations to students about how they can develop their CVs, how they can write their CVs and prepare themselves for interviews. We also very much welcome students to send us their CVs or to give us a call just to ask for some advice and support around how they can go about getting themselves a job, how they can prepare themselves for interviews, that sort of thing. We're more than happy to do that for student PAs. Then moving forward, we can help PAs with finding jobs. When you're applying for a job, whether you're going into applying for general practice or whether you're going to secondary care, the routes and the processes are very, very different. General practice is a bit more Wild West in its approach to recruitment, whereas the hospitals are very much, they're very formulaic. There are different processes, there are different layers. So it's a very different approach. It's about understanding those different approaches, depending on what you as an individual want to do in applying for your jobs. We help with recruitment. We have jobs. We have a jobs board, which is your-path.com, which is a jobs board open for everyone to use and it's free of charge. We are commissioned by Health Education England to help the role of GP supervisors of newly qualified PAs. We work with GP federations, primary care networks and GP practices to be able to help those practices understand what a newly qualified PA is and the preceptorship program that they need to have in place to be able to introduce newly qualified PAs into general practice. So make sure that those practices understand what the goal of a preceptorship is, to make sure that the PA is supported in their learning, but also to make sure that the practices are able to use a PA at the full scope of their practice. There's no point in all these practices employing PAs if they're then going to get it a bit wrong and it will lead potentially to role failure at some point further down the line. So we try and get under the skin of a PCN, understand that PCN, understand how PAs are able to work with that PCN, whether it's as a generalist on the front line or whether it's in a more specific role, maybe working on long-term condition management or early cancer diagnosis or perhaps as a care home lead. There are different nuances to the preceptorship program that needs to be in place to be able to support those PAs to do those various things. And the other things we look at as well as PATH, we're always looking at service modelling to see how the role can be developed or changed, and there are different ways of supplying or employing PAs to do the work that they need to do. So is it something that always has to be virtual, or can the work be done remotely, or is it something that needs to be done on site, or can it be done in a different way? For example, the care home lead is a good example of that. You know, there are ways of modelling that the care home lead, so it's specifically run by physician associates with GP support, with the clinical pharmacist support coming into that. But the practices need to do the work, to do the legwork, to be able to support those PAs to be able to do that work themselves in the first place. So it's very much a case of helping those practices understand that what they put in leads to a better of what they get out at the other end.
Okay, that's brilliant. That sounds really good, Nick. And how much does it cost the PAs who want to get these interview skills and the practice and the talks about how to get jobs? What does it cost them? Absolutely free of charge. We don't charge student PAs or newly qualified PAs for any support for anything that we offer to them. We only charge employers for our services. Everything we do with newly qualified and student PAs is free of charge. We're here to help. And if people want to find out more and access those services, where's the best place for them to go? If you go to www.our-path.co.uk, you'll be able to register on the websites. There's contact details on the websites. If you go to our jobs board, which is your-path.com, there is actually a CV writing guide on there as well that is available for anyone if they want to use. But certainly the first point of call would be our-path.co.uk. Perfect. And I'll leave links to the things that you've spoken about in the show notes so people can find them on their device under the show notes that they're listening to this on.
Thank you.
How do you see the physician associate profession developing perhaps in the next 10 years? Where do you think things are going, and how are path going to evolve, do you think, as well?
Ooh, that's a big question. Primary and secondary care, I think, are both slightly different. I think that secondary care is slightly ahead of the game, but certainly emergency medicine and acute are further ahead of the game in where they're developing the role of PAs. I think that general practice has a little bit of catching up to do. I think the role of PA should be moving forward a lot more with PAs moving into more leadership roles, into management roles. General practice, for example, there are 1 or 2 PAs that have become partners in practices. So I think very much PAs need to understand that there is a route to partnership working in primary care. In secondary care, I suppose I would like to see PAs starting to move into those leadership roles and taking on wider responsibility for the delivery of patient care with more responsibility. Prescribing is obviously high up on everyone's list all of the time, but I think that's, to be honest, a smaller issue in the grand scheme of things. I think this is more about developing the role of physician associates. I'm not saying it's comparable to the role of consultants, but there would be opportunities, I think, in the future where PAs can start leading whole services with that dependent practitioner element slightly moved in a different direction. If you look at perhaps the states where physician associates are actually running urgent care centres, that I think is a model that could potentially work eventually in time, maybe with PAs running convenience care centres, minor illness services. There are whole sectors that still aren't looking at the use of PAs. You've got secure healthcare where PAs aren't yet used. You've got the MOD where PAs aren't used, but actually that's their background and their DNA. You've got things like community care, which have been still fully to be explored by PAs. And again, mental health. Mental health is really starting to charge forward with the use of PAs, but I think there are still opportunities there for PAs. So I think at the moment it's still more around scoping out where PAs can still add benefit to the existing workforce, and then looking to the future 5 years down the line where PAs can start to really take on leadership roles. And also the educational development of PAs. There are opportunities for PAs to start to move into education. There are still pockets of the UK that don't have any PAs whatsoever, and where they would be desperately needed. Parts of Wales, parts of Scotland, Northern Ireland would benefit greatly from additional PAs. So I think at the moment it's still very exploratory as to where PAs can go, where they can go, and maybe over the next 5 to 10 years the journey becomes clearer.
Is PATH predominantly a London-based organisation, or have you spread far and wide across the UK?
We are far and wide across the UK. So we've worked with Scotland, Ireland and Northern Ireland, as well as parts of Wales. Unfortunately, London always plays a dominant role in everything, but I think that's more to just purely to do with its population size and the way that things move very, very quickly.
And do you do any work with physician associates who are looking for locum opportunities?
We do work with physician associates on a locum basis, and we do provide locum PAs. But we have to be a bit careful around the role of physician associates, particularly newly qualified physician associates coming straight out of universities, sitting their national exams, and we try to avoid that where possible. If you're a newly qualified PA, it would be like trying to put a house officer into a staff grade role in an A&E department. It's got to be handled with some caution. And I think newly qualified PAs need to have that year of grounding, that newly qualified year, that preceptorship year, to be able to really understand the speciality that they're working in before they can start to think about locuming in that environment. It's not fair to the employer who are hiring a locum and want them to get on with a job. It's not necessarily fair to the PA because they may not fully understand the role that they're going straight into and may struggle in that role, and it may have an adverse effect on their future career. And equally, it's not fair to the patient. The patient is not going to necessarily have the best experience from a newly qualified PA going into a locum role. So we are cautious around the role of newly qualified physician associates working into locum roles. But certainly there is increasing demand for locum PAs. But again, caveating that with ideally they need to be experienced PAs to be able to get on with that, because the supervision and training by the very nature that you're a locum, they're calling for a locum, it means that there may be some degree of understaffing in a department or in a practice somewhere. So there won't necessarily always be that supervision around that is needed for a newly qualified. So if the demand is there for experienced PAs.
That's brilliant. Nick, thanks so much for giving up your time to explain a bit more about PATH to me. I found it really useful to find out a bit more, and I'm sure the people listening will also benefit. If they want to get in touch with PATH, what's the best way for them to find you?
Easiest way is to visit our website, www.our-path.co.uk, where hopefully there'll be lots of information on about the role of physician associates. There'll be some jobs on there and also our contact details. So more than welcome to drop us an email at any time.
Thanks, Nick.
No problem at all. That's absolutely fine.
And thanks to you for listening as well. I hope you found that really useful to find out a bit more about PATH. You can get in touch with me at the Physician Associate Podcast. We're on Facebook and Twitter at PA Podcast UK. And I hope you join me again for the next episode.
Thanks for listening to the Physician Associate Podcast.